everyone, welcome to my channel. I'm Dr. Perkins. I'm a board certified OBGYN, and our channel talks about questions that you have about your body. Today, we're talking about how do you know if you have endometriosis? You should watch this because we're talking about what endometriosis is, how it is diagnosed, and the testing that can be done to let you know if you have endometriosis. So let's get into it today. What is endometriosis? Endometriosis is a very common condition. In fact, there are probably more people living with endometriosis than they are aware. And this diagnosis is not one that is very easy to come about. Because of that, we don't know that endometriosis exists within our bodies at times. Now, endometriosis affects, we are thinking up to about 7 to 10% of females, but clinically, I think that this number is way lower than it actually represents in real life living. But let's talk about what it is. To help you understand, I'm bringing out my model here. This is showing you the basic anatomy of your reproductive system. 2 fallopian tubes, 2 ovaries, if I can touch them well here. We have 1 uterus. The cervix is the bottom part of that uterus, and the vagina. With endometriosis, tissue that is normally on the inside of your uterus is displaced or is found in other areas of your body. Look at the uterus a little bit closer here. The uterus has 3 different layers to it. This inside area is a space. This is where a baby will develop. This is where periods come from. That's the endometrial cavity. The next area here, right in the middle, these are muscles. That's the muscle of the uterus. These muscles contract. That's what they're there for. They also grow in size to hold the baby. When they contract, you may have cramping like with your periods, or you have contractions when it's time to give birth. The third layer of your uterus is like the outer skin area. It's a very thin layer, and it's very important to hold the entire uterus together. Now, let's go back to this inner area. In this area, your endometrial cavity, you have glands. Those glands are what produces a period usually. In endometriosis, these glands are located elsewhere in the body. Now, glands are responding every day to hormones. These hormones tell the glands to grow more. They tell the glands to shed and to break down and to create a period. And it tells the glands to, respond and help a pregnancy maintain itself throughout the entire pregnancy. These are all very, very important aspects of the endometrium. In endometriosis, those glands can be anywhere in your body. I'm going to show you another model here. The glands of the endometrium can be located anywhere internally. They can be located on your intestines, on your stomach, on your liver. They could also be in your chest cavity, by your lungs. They can be in your arms, your head. Those glands can be anywhere. Now, if you can imagine, if those glands are responsible for creating periods, whenever your body instructs those glands to bleed, they bleed. Wherever those tissue are located, you're also having bleeding at the time that your uterus is instructed to bleed. So you're having mini periods anywhere in your body that these glands are located. This makes endometriosis a very, very complicated and difficult disease. First off, because a person suffering with endometriosis, they're having excruciating pain when their menstrual cycle comes on. They may even have these pains right before and even mid-cycle. Everything is magnified in their bodies, and medications, especially things that you can get over the counter like Motrin or Advil or Tylenol or even Midol, they really don't help with the pain of endometriosis. Do you have endometriosis? Have you been suffering, or do you think you may have this condition? If so, we'd love to hear about it below. Leave a comment and let's share so that we can learn together and know what your experiences have been like. We're going to continue with this conversation on how to know if you have endometriosis. The first step to knowing whether or not you have endometriosis is to talk to your doctor. Explain to them everything that you're experiencing, details about your menstrual history, and all the things that you have tried to help with the pain or discomfort that you might feel as you go through your menstrual cycle. With that, your physician or your provider will do a pelvic exam. The exam is very important because, one, it will rule out any other masses or growths inside of your pelvis, and if you do have specific areas that you may have endometriosis located internally, sometimes as we palpate or feel or examine that area, it might exacerbate the pain. And that might be a clue that you may have an implant or endometriosis glands located in that area. Endometriosis is diagnosed in a couple of different ways. Firstly, your doctor may order a pelvic ultrasound. This is like the gold standard to trying to figure out what is happening in the female body, in the pelvis. With this ultrasound, if you have endometriosis, a very small subset of people may have a special type of cyst on their ovary. This cyst is referred to as an endometrioma. It looks very different from what a typical ovarian cyst will look like. Typically, that cyst will be filled with water. Sometimes it could even have hair and skin and nails and fat, maybe even bone. That's a different type of cyst. An endometrioma cyst is a collection of period blood in a sac, and sometimes we refer to it as a chocolate cyst. This is specific and unique to endometriosis. Now, a very small set of people with endometriosis may have this type of cyst on their ovaries. For everyone else, diagnosis must be made by laparoscopy. That is a surgical procedure. This is because endometriosis implants or glands are so small that there are no imaging tests outside of the cyst that I just mentioned. There's no other testing that can see these small, very tiny implants that could be anywhere in your body. The best way for us to be able to give you this diagnosis is to visually see with our own eyes. Laparoscopy gives us that chance to do that. We place a camera inside of your belly, we look around, and we look for evidence of having these collections of blood called implants in your abdomen. There are other things that we might notice as well. For instance, endometriosis causes a lot of scarring internally. And so on laparoscopy, we can see that. Endometriosis may also cause blebs. These are like little collections of fluid on the inside. Again, visually, we're able to see that. Now that's the best way for us to give you that diagnosis. Outside of that, clinical expression, whatever you share with us about what your experiences are like, are really the only way we can go about considering or thinking that you have endometriosis. One benefit of laparoscopy is that it can be therapeutic as well. That means that we can actually fix the situation. This means that we can actually try to bring you relief by removing those implants. We can excise them, meaning that we can cut them out. We can ablate them, meaning that we kind of burn them and prevent them from being active anymore. There are other options as well. And if you're thinking that you may have endometriosis, it is worthwhile to talk to your OBGYN about what you're experiencing and the possibility of doing this type of diagnostic surgery to see if you actually have the disease. We've learned a lot today about endometriosis, and it's been wonderful being here with you. Below is a link to my free ebook that I'm offering you today. There's absolutely no obligation. Just click on the link and you'll be able to receive this. This book is called Hormones Don't Lie. With it, you'll learn all about female reproductive hormones and how to best manage them. I'm Dr. Perkins, a board certified OBGYN, and thank you for being on my channel, and I'll see you next time.